It's 8:49. Joining us now from Bronson, it's Dr. Phillip Dabrowski, an orthopedic physician with Bronson Orthopedic Specialists with offices in Battle Creek and Marshall. Doctor, good morning. Nice to have you with us.
Good morning. Thanks for having me.
We're going to talk a little bit about joint pain and different ways of treating that. I know that you specialize in hip and knee and shoulder joint replacement surgery, but before we get there, what are causes of joint pain?
I see people for a variety of reasons for pain, but I think the predominant reason people come to the office is, your typical wear and tear joint arthritis. We're an active population. We want to do things, and sometimes the arthritis or the cartilage that you're born with just isn't enough to withstand your lifestyle. So that cartilage wears out, and that's what we typically call arthritis. And those are the major joints we see a lot of wear and tear in because of the activities people do. So I think that mostly people see us for arthritis, but there's a couple other reasons people can come to the office, but that's predominant reason we'll see them.
And where do you start in treatment with people who come to you with joint pain?
Obviously, we try with the most conservative, easiest things to try to relieve pain. I mean, if it's an anti-inflammatory type medication, something simple over the counter, or even some easy therapy or exercises they can do to kind of promote joint health, that's where we'll start. I mean, there's obviously more invasive and more advanced things you can do as you go, but obviously we try to start with what works first, that's easiest on them.
You mentioned anti-inflammatory meds. Are there concerns with these? It seems like there was some concern about Celebrex and some of these types of drugs a few years ago. Where are you at as a physician prescribing these?
Anti-inflammatories like Celebrex were really in vogue several years ago because the inflammation people get in their stomachs when they take a lot of high-dose anti-inflammatories. So when you get bad arthritis, it takes quite a bit of that medication to really kind of relieve pain. But used appropriately, there's several of those medications that have been proven to help relieve pain. So we're still using them. The ones that had shown major side effects have been pulled from the market many years ago. So there's a few of those type of class of medications that are still around. We obviously are still using your simple over-the-counter ibuprofens and Aleve type medications with good success. But like all things, those things are only good for a while and then maybe don't work as well anymore. But
Yep.
that's usually a simple thing to start with.
So if we've tried every non-surgical option like that, then what's the next step to treating joint pain?
Well, that's where we can step in as orthopedic surgeons and provide a level of care that's more advanced. I mean, there is something short of just medications. I mean, we've tried joint injections as well, but again, usually those are short-lived as far as their usefulness. But what we really specialize in is the replacement of joints. Shoulder, hip, knee replacements are predominantly what we do, along with sports, but this is what we see in the aging population. And what we end up doing is replacing that diseased, worn-out knee, the cartilage that's worn out, with a new knee that's composed of metal and plastic. And people can get around on that as a new knee.
And how long have you been doing this?
I've been in practice 6 years.
Mm-hmm.
I was practicing in the Muskegon area prior to here, but moved closer to family. So starting over in this area. So,
well, it probably in the last 20 years, it's just incredible the advances that have been made in this area of surgery.
Yeah, and that's where I think that getting better outcomes and quicker return to function is what really is changing in the orthopedic world. I mean, I can remember the days of people coming to the hospital after a joint replacement and being there a week or two, down to a couple of days where we thought we were doing pretty good, and now we're down to a day or so. And sometimes in the future, I think these will be outpatient procedures, but that's sort of the next frontier. And what really helps with that is sort of our techniques and advances in the surgical methods that make this a really exciting field at this time.
Yeah, so if people are nervous about it, and I guess probably everybody is to some extent, just know that we're talking state-of-the-art technology and some of the best trained people around.
Yeah, and I think the Bronson Battle Creek does an excellent job at those fears. I mean, I can, as a busy surgeon, I have a time to talk to patient about those fears, but maybe people don't feel like I'm as available as some other times for like a nurse to talk to them. So we have a navigator that works with the patient from the time I sign them up for surgery to the time they go home, where if you needed more questions answered, had a specific question about how I do things compared to a different doctor, that point person's there for you and takes you through the whole process while you're on the floor, everything. So it's sort of just a friendly face through the whole process that's helpful at kind of keeping you up to date on what's going on. They teach you a pre-surgical class. I think things that the questions you don't even think to ask are mentioned. So it's a pretty extensive program when it comes to bringing people through.
Not only that, but I mean, we all know people who've had joint replacement surgery these days, and they were all a little nervous going in, and the day after they were, they were aching a little bit, and talk to them like a month later, and they are just like, wow, new lease on life.
And that's what we love to see. I mean, that's one of the true benefits of doing what I do is these almost tangible results that we think we can get in a quick time. I can take a problem and fix it, and that's what drew me to orthopedics. Sometimes I feel in medicine we don't know if we have a cure for it. We've got a treatment, but in the sense of joint replacement, I think that we take a problem that has serious consequences in your lifestyle, and we can fix it, and that's in a really timely manner, and that's what's really exciting.
What do we need to do to make an appointment?
You can go to our website, which is www.bronsonhealth.com/ortho, or they can call my office and schedule an appointment with me or any of my partners at 877-704-3133.
877-704-3133. If anybody missed that, I've got the numbers here, and you can call me at the radio station. I'll be happy to pass that along. But Dr. Phillip Dabrowski, really nice talking to you about joint pain today. Now get back to work.
All right, will do.
Thanks a lot.